I'm Megan Grant. I'm 16 years old and I live in Sunrise, Florida. I've been playing soccer for about 11 years. I love that it teaches me how to solve problems as a team, but then also as an individual.
I started seeing Megan take an interest in soccer at about 2 or 3 years old. She really took an interest to it and wanted to do good at it. She wanted to be the best at it. I was present when Megan hurt her knee. I was in the stand, and when she turned and fell, I knew almost instantly that something was wrong.
I was running to the ball and my cleat got stuck in the ground. So when I went to turn, only my knee turned and then I tore my ACL. When I heard the news, I was so shocked. I definitely got sad because I was like, this is gonna be so long that I'm gonna be out for.
After the injury, I reached out to my wife. She was at work, and we called Dr. Moya.
I've known Dr. Moya from before I had the whole knee stuff because he's my family friend. And then he also used to work with my mom. Dr. Moya assured me that if I trusted in him and just listened to what he had to say about taking it slow, that I'd come back and I'd be healed and I'd be able to return to soccer.
Anterior cruciate ligament injuries in the United States and in the world have become one of the most common injuries. Fortunately, we have technology and we have a surgery that can be done to the patient to restore their activities. What type of injury Megan had was for me very critical to understand. This is the ligament that tears by doing this. Her surgery is to take the center part of the patella tendon with a piece of bone and piece of bone and then put it inside the knee joint, like here, and secure it in place with screws on the tibia and screws in the femur. The success rate for this is greater than 90 to 95%. For me, it's a routine surgery because I've done this a couple thousand times.
The day of the surgery, I had to wake up super early. I remember as soon as we got to the hospital and I was like, oh my gosh, this is actually happening now. Then I remember I woke up in pain and my knee was hurting. I went to physical therapy for the first time, I think a day after surgery.
There is such a big mental component to this whole rehabilitation process. Initially, right after surgery, it's the pain. How can they deal with the pain? Because some of them have never endured a surgery before.
And the first day was definitely hard.
As the session went on, I got to meet her, get to know her well, and we kind of almost built a rapport on that first day, just letting her know that, hey, I'm an athlete. I've been in your position as well, and I understand you, and I'm here for you.
It was really helpful that everything was done with Baptist. Everything was just in one place.
Having the team all underneath one roof, from the doctors to the physical therapists to the nurses that may have cared for her during her surgery. The big word that screams out to me is always consistency. Consistency in communication, putting patients first, always.
The first game she played after the surgery, I was emotional.
I was definitely scared. I was really nervous that someone was gonna hit me wrong or anything and then I'd hurt it again.
And she played a very physical game where she actually got knocked over a couple times. And she got up and just run like nothing happened. And at that point, I'm like, okay, she's on her way back.
I have no problems with my knee at all today. I have no pain. And honestly, it feels like I didn't even tear it.
So Baptist makes the process of seeing the patient, having the surgery, and the rehabilitation easy. We have all the facilities at Baptist. So the patient can come from us from day one and leave us at 9 months to go play, because we have the gamut of professionals that are into making sure that you get better and you get back into your life and into your sport.
When you walk in here, it's a team thing, right? Your problem is my problem, and we're gonna help you figure this out.
For me, it's a privilege and an honor to be an orthopedic surgeon.
Baptist Health creates that environment that allows us to do what we initially signed up for, and that's being there for people.
Today, my soccer career is going really well. I'm focusing on getting recruited for college. After everything that I've gone through, I'm leaning towards becoming an orthopedic surgeon. I've been through the process, so I know what it's like, and I also know the mental side of it. I'm also inspired by Dr. Moya.
It makes my day to know that she's thinking about being an orthopedic surgeon, and I do hope she becomes an orthopedic surgeon so that she can take over my practice one day.
I do think my story is inspirational to other people. They can see what it's like, and that if you put the work in, you can get back to where you were and to be stronger than you were before.